Transforming Cancer Care was a programme that lasted a number of years. The main part of it was the opening of CCC Liverpool, but there were other parts as well, including the integration of the two hemato-oncology, so the two blood cancer services in Liverpool, as well as kind of strengthening the network model of care across the whole of Cheshire and Merseyside. The point of building CCC Liverpool was always to be closer to the main population of Merseyside, was to be closer to the university and to be closer to an acute hospital. With about 2 days left before we opened, there was a real change where it went from this is the most stressful thing ever and people were getting a bit touchy with each other, to everyone sort of, I think, realising that it was going to be okay. And then so that on the morning of the actual opening day, it was a really sort of fun environment. I think that the patients were absolutely astonished. They got a sort of a welcome committee, a round of applause out of the back of their patient transport ambulances into the building. 5 years down the line, to see the building still there, to see it sort of flourishing. Lots of things to do still, lots of work still, but I think, good foundations for us to build on.
So research at Clatterbridge is key to everything that we do. Within my portfolio we have lots of different clinical trials, and these clinical trials will give hope to people that perhaps don't have hope. They perhaps come to the end of the line with certain treatment options. Potentially going on to a clinical trial could help them or help people in the future. When I started, it was very apparent that the senior team are very supportive of research, so that's half the battle won already, because you're sort of banging on an open door, if you like. There was already that thirst for research within Clatterbridge. It made everything so much easier. I'm most proud of my team. Every day you see and you hear how they focus on the patients and how they understand and recognise that is the most important thing, and that's why we're doing what we're doing. I think because we have come so far, it's now seeing where can we go. Thinking about the cancer vaccine work, part of collaborations nationally and internationally with regards to cancer vaccines. So, really, really important area, and just really excited to see where that goes.
So the workforce and organisational development team, I always say, is a small but perfectly formed team. I think over the past 5 years we've done so much work around supporting our staff and making sure that we create that culture that allows our staff to be at their best.
Our staff are our most important asset here at Clatterbridge, so it's really important that we look after them.
I think my highlight has got to be the staff awards, so our annual Staff Excellence Awards. Seeing all of our staff come together, celebrating the amazing work and achievement of our staff.
We've enjoyed preparing the CCC Fest that we saw in the summer. We also have our Live Well, Work Well events in the winter, which are our staff health checks, which have been very much well attended, and we've had some really good engagement.
If I was to describe working for the Clatterbridge Cancer Centre in a word, I think it would be kindness. We are kind to each other, we support each other. Our staff survey results show that year-on-year improvement, but that kindness and that how we work together as a team is so important, and that is something that I really enjoy about working here at the Clatterbridge.